2 months ago, a dentist told Norma Navarro her children had 3 cavities each. For most parents, the next steps would be routine: book appointments for fillings and prepare a lecture on oral hygiene. For Navarro, it isn't so easy. She and her 10-year-old daughter, Aneth, are in the country illegally. Her 7-year-old son, Angel, was born here. That means Angel is covered by a traditional public health plan, while Aneth gets spotty coverage from the state's Children's Health Development Program. The plan gives her just 1 month a year to get checkups and follow-up care. Her family's mixed status puts Navarro in a tight spot.
For my daughter, they told me they first had to acquire authorization, and for my son, they said, okay, he can come any day. I told them that I elected to wait for my son and to please hurry on the authorization for my daughter, because sometimes my daughter does ask me, why does my brother sometimes get help first, and why don't I?
Navarro says her husband is willing to scrape together extra money as a mechanic or borrow from family to pay for out-of-pocket emergency care. But she struggles with the idea of her children receiving unequal preventative care as they grow and develop.
This is something that hurts me very much. I would very much like my daughter to have the same kind of privileges that her brother has.
For Navarro, navigating the healthcare system for her children can feel a bit like a Sophie's choice, and the gap between what's available for Aneth and Angel is only slated to grow. While the Affordable Care Act will expand health coverage to millions of currently uninsured Americans, it doesn't extend benefits to the nation's 11 million undocumented immigrants. It will also cut by half the aid to hospitals that serve them.
Here's the school-based health clinic.
For the nation's undocumented population, little will change. For them, school clinics like this one at Central Elementary School will continue to serve a critical role. City Heights has 4 of them, and already they're acting as medical homes for students and their siblings, regardless of their immigration status. They're operated by the local Mid-City and La Maestra clinics, but they feel much more like small family practices.
What do I do if you say blood sugar instead of blood glucose?
That's McLaurin again with a student during lunchtime.
Well, the advantage of having a medical home is that you have one place that has all of your medical information, and also that you have better follow-up.
McLaurin and clinic staff recently saw Navarro's daughter for a speech impediment that had been ignored at her yearly checkups. They immediately set her up with a specialist and are looking into a surgery that could help. They also had Aneth see a psychologist because her classmates are teasing her about the way she talks. Central's principal said she knows that treating undocumented kids like Aneth is a hot-button issue. It invites criticism from people like Pete Nunez. The former U.S. attorney heads a conservative think tank in D.C. called the Center for Immigration Studies.
Somebody breaks into my house and gets hurt or gets sick. I don't want to have to pay. I shouldn't have to pay for that. So if someone comes here illegally and they get sick or they get injured, why should the American taxpayer pay for that?
Emergency treatment for non-urgent illnesses costs taxpayers more than $30 billion annually. 15% of the uninsured obtaining those services are undocumented. Steve Eldred is a program manager for the California Endowment. He says we should consider the cost of denying immigrants preventative care.
Healthcare as a human right, I think is part of the endowment's belief, and part of my own value system as well. But even if you don't accept that, if you look at it strictly from a cost perspective, by denying people to primary care and preventive care, you're creating a system where they're going to seek the most costly care there is.
Eldred helped open City Heights' 4th school clinic in October, and he says 2 more are in the works. But a big piece of the puzzle is still missing in City Heights and the rest of the nation: care for undocumented adults. For that, Eldred says we'll have to look at the bigger picture.
Health doesn't come from a doctor's office or from a prescription pill. The biggest factor that determines somebody's lifespan is their zip code.
And lucky for Eldred, bringing parks and healthy food into neighborhoods can be done without bringing border politics into the mix. Megan Burks, KPBS News.